You or someone you know is probably suffering from the flu. This year's season is in full swing.
And health experts predict we haven't even seen the worst of it yet. Patients from coast to coast are getting socked. 41 states are reporting widespread cases. At least 18 children have died from the virus. In Chicago, about a dozen hospitals have had to turn patients away. Health experts say the flu vaccine covers 91% of the flu strains out there.
So what can you do to prevent the flu from getting you? Amanda Kita Yarbrough is the communicable disease epidemiologist for public health of Madison and Dane County. So Amanda, how bad is the situation in our area? We've heard in St. Mary's, 45 patients. Just how bad is it out there?
We're seeing a lot of hospitalizations right now. Anecdotally, we're hearing about a lot of people ill. This is definitely worse than last year's flu season. It's hard to say, if this will end up being a typical season or if it's going to be worse. I think we're still kind of moving up, and we'll see what happens.
If you haven't gotten sick yet, are there things you can do?
Sure. It's not too late to get the flu vaccine. It takes about 2 weeks to become effective. It's not 100% effective in preventing flu, but it does make symptoms milder if you get it. And then also kind of some basic common sense things. Wash your hands often. Try not to touch your nose, your mouth, your eyes. You can introduce virus into your body that way. If you are sick, cover your coughs and sneezes and stay home until you're better.
Just stay home.
Stay home.
Don't infect anyone else.
Just for all the hypochondriacs, including myself, how do you know if it truly is the flu? What should you be looking for?
You don't really know for sure if it's the flu unless you get tested. But influenza generally has a fever, and then cough, runny nose, sore throat, muscle aches, body aches. You feel pretty sick. It's more than your typical cold.
Yeah, I had it last week. I can tell you, you nailed it on the head. Who's most at risk here of getting it and having more serious consequences?
Well, anyone can get influenza, but people who are more at risk of serious consequences would be elderly people, pregnant women, and really young children. So it's really important that all of those individuals get their flu vaccines if they can.
When we look at this from a broad perspective, how does the flu virus sort of interact? Are we going to see exponential numbers then come down, or how does this all sort of go away? As we look towards the end.
Usually it'll increase for a few weeks, and then it will kind of run out of people to infect. People will be immune to it. And this is a flu strain that's been around previous years, so some people are already immune. And so it generally increases for a few weeks, maybe 6 to 8 weeks, and then it starts to come back down.
And a lot of people are saying, well, hey, I got the shot, why am I getting sick?
Yeah, well, like I said, it's not a 100% effective vaccine. No vaccine is. I wish they were, but so it is still possible. But again, it can make your disease milder.
So they have to pick out which strains they think are going to hit the country. Is that how it works?
Right. They prepare the vaccine well before the flu actually starts circulating. This year, the flu vaccine does match what's circulating. There are years where it doesn't.
What's most concerning are the deaths from the flu that we hear. So if your child or an older loved one has the flu, what do you need to do to really protect them from the absolute worst?
Well, definitely contact your healthcare provider if you have concerns or questions. And they'll make decisions about whether antivirals are appropriate or whether they should come in to see the doctor or be hospitalized. So it's best to contact your healthcare provider.
Absolutely great advice. So let's get through this and hope for a nice warm spring.
Yes, let's hope
Amanda,
so.
thank you for being with us today.
Thank you.